to discuss the first of its kind technology. For the first time, a DPP-4 inhibitor has been combined with the extended release metformin. The first of its kind technology, where the technology is known as gel shield diffusion technique. And so you can see here in this technique, this tablet coat, the outer coat has been given as an immediate release hexagliptin, that is the DPP-4 inhibitor, and the inner coat that composed of the metformin hydrochloride. And this is a dual polymer hydrophilic technique. So here, so what's the technology? Just once the patient swallows the drug, it enters the gastric, the stomach, and the immediate release hexagliptin is released, and it works for about 26 hours. So then the gastric fluid will enter and imbibe inside the polymer matrix, and it will swell up in the form of gel matrix. So once the gel matrix swells up, there are spaces in between, and the metformin will be released slowly over a period of 10 hours. So as you know, the half-life of metformin is in and around 11 to 13 hours. So over the 10 hours and the 13 hours, the coverage will be in and around 24 hours. And we have already have the hexagliptin part, which gives you a 26 hours glucose control. So as a combination, as a logical combination, and with this technology, it will be better to control all the three components of glycemia, like HbA1c, PPG, and fasting, with a single dose therapy. That's once a daily therapy, which is expected to increase the compliance, adherence, and efficacy. So next, I'll again ask Dr. Mukhopadhyay to continue with the clinical evidences.
You can take the questions at the end. So, what are the clinical evidence of KombiglyXR? Okay, this was done in one of the studies where they looked at 743 adult patients with inadequate glycemic control on metformin. They had HbA1c between 7 and 10, 24 weeks duration. Base therapy was between 1500 to 2550 milligrams for at least 8 weeks. And they were put into 4 arms. One group had saxagliptin 2.5 plus metformin, one had saxagliptin 5 plus metformin, other had 10 plus metformin, other had placebo plus metformin. Okay, the rescue protocol was that if the patient was uncontrolled, you could add pioglitazone if the didn't work. And as you can see, with 5 mg metformin, 5 mg saxagliptin metformin, you got the greatest HbA1c reduction. Whereas in the metformin placebo group, we have a 1.3 increase in your HbA1c. Saxagliptin added to metformin for adult patients on uncontrolled metformin, 43.5 patients achieved their target below 7% with 5 mg saxagliptin added on to metformin after 28 weeks. So a higher percentage attained their goal. Saxagliptin added to metformin uncontrolled on metformin alone plus placebo at 102 weeks, that means at 2 years, 30% still remain at their target. So the biggest problem with any oral drug with diabetes is their durability. After some time, you'll find the effect of the drugs going on. But this has been shown not only with this drug, with the other DPP-4, that at 2 years, majority of them can keep their HbA1cs down at that point of time. So the durability of all the DPP-4, including saxagliptin, is well established. So we have increased glycemic control if we add saxagliptin 5 mg along with metformin. Of course, the dose of metformin varies between 1500 to 2000 depending on the requirement of the patient. These are the Diabetes studies which show improved glycemic control from their, this is from the data which they produced to the FDA when they get the license to the drug. This data on file. The efficacy of KombiglyXR as a fixed dose study was done, and we found that saxagliptin metformin XR, okay, the mean change of the from baseline to blood sugar was around 14 milligram percent. That is with 1500 milligrams metformin. This is called mean weighted glucose, okay, which conveys that average exposure of blood glucose over 24 hours, and is obtained by define the area under the curve over 24 hours. So it also has sustained glycemic control. This study showed that after 4 weeks, there was a greater reduction in baseline in the saxagliptin plus metformin group compared with the metformin group alone. That is the initial one, and after giving with placebo, after giving at 4 weeks, you can see that the saxagliptin metformin combination, the excursion is much less, well below that. There is a separation between the placebo group and the saxagliptin metformin group. Effect on fasting blood glucose with the you can see with saxagliptin metformin sustained lowering up to the 4 weeks period in the study was done. Weight change at 2 years, 112 weeks, that is from placebo plus metformin minus 0.8, but with saxagliptin it was 1 and metformin was 1. Of course, with others it was 0.5. So it does not cause any weight gain. It was may not have caused weight loss, but must have caused some. It was weight. What was the other indicators that at 2 years the incidence of hypoglycemia was as same as placebo. Placebo was 10%. All these figures are not more than 10%. What are the ongoing clinical trials? We have now 2 big trials going on. That is the multi-center trial with double-blind diabetes in saxagliptin, added on to existing metformin versus uptitrated metformin. So instead of increasing the dose of metformin, we have saxagliptin. This study is looking at whether you get a better control than if you uptitrate the metformin. And this is another study which is also double-blind study, where the efficacy and safety of metformin as an add-on to metformin versus XR versus metformin XR uptitrate. So results will become, that's your prescribing information. And thank you for your patient hearing. You can have questions. This, while I will be discussing, you can have a look at this slide. This is the commonly asked, we have these 4 DPP-4 inhibitors, that's why I put up this slide. It's a comparison between the 4 DPP-4 inhibitors on various fronts. Its approval, its dosage, use in renal failure, liver failure. So this is a comparative study between the 4 DPP-4 inhibitors which is available in the market. Thank you for your patient hearing.